right, thank you all so much for joining us today. I would like to start by having our panelists, prior to our host coming on, to introduce themselves and to just share. I want to be very clear that the opinions they're sharing this evening are their own, and unless otherwise stated, not the opinions of their sending universities or organizations. So if we can start maybe with Dr. Sonali Rajan, and I think also too, could you just share a little bit about everyone, where you're coming from, what your expertise is in, what is it that you do day to day in the gun violence prevention space?
Thank you, Gigi, and it's so nice to be here and see so many of you joining us on a very rainy Wednesday night here in New York City. I'm a professor in the Department of Health Studies and Applied Educational Psychology here at Columbia University. I'm a gun violence prevention researcher. My work has focused now for many years on the impacts of gun violence on children in particular, and on the impacts of gun violence in schools. And I'm very much focused on what solutions we can and should be employing to reduce harms for children, for school teachers, and the communities in which their families and everyone live and learn and play. And I really think a lot about the intersections of public health and public education. So that's really where the bulk of my work lies. And I'm here in my apartment with my 9-year-old, so I apologize in advance for any noise you might hear.
Thank you so much. Dr. Halleh, how about yourself?
Hi, everyone. I'm Halleh Akbarnia. I'm an emergency medicine physician over here in Chicago area. I've had about 20 years of experience taking care of gun violence victims in level 1 trauma centers. I'm a teaching faculty over at UIC emergency medicine residency program, and I hold my master's of public health from UIC as well. I've been on multiple boards for organizations like Illinois College of Emergency Medicine Physicians, Doctors for America. I do a lot of grassroots type work in the space. Have led a bunch of the gun violence prevention subcommittees in these groups, involved in our national organization as well, and part of the advisory board for This Is Our Lane and Newtown Action, where there's also a lot of survivors who are part of those groups. And as a survivor myself, I've had that lived experience that continues to kind of fuel my own commitment to addressing firearm injury as the public health crisis that it is. So I'm very honored to be part of this conversation tonight as well.
Thank you for all of your work, and thank you for disclosing your status as a survivor. I know how hard it must be to come to this work as an impacted person and someone who is impacting all this work. Speaking of someone who needs no introduction, Kris Brown, president of Brady, and our moderator for this evening.
Sorry about some technical challenges that I had, but wonderful to be a part of such an esteemed group of healthcare providers for what I hope is a really, really great and important discussion.
Thank you so much. Dr. LJ.
Thank you for the invitation to join. I'm LJ Punch, joining you from St. Louis, Missouri. I'm a trauma surgeon by training and founder and medical director of the Bullet-Related Injury Clinic, also known as the BRIC, which is an outpatient space of holistic care for people who have been wounded, threatened, or lost a life to a bullet, including them or a loved one. And this care has been part of a real evolution of consciousness for me in recognizing the widespread impact a bullet has, whether someone has been physically injured or not. Again, I appreciate the chance to share this time with so many folks in this work.
Thank you, LJ. How about Fatima?
Hey everyone, Fatima Loren Dreyer. I'm Executive Director of the Health Alliance for Violence Intervention and the Executive Director of the Kaiser Permanente Center for Gun Violence Research and Education. The HAVI helps stand up hospital-based violence intervention programs. We've been doing so for over 15 years. And the model hospital-based violence intervention treats patients at bedside who've been violently injured and supports them post-discharge in the community. We're now, HFIPs are now in over 100 cities throughout the United States. through Kaiser Permanente Center for Gun Violence Research and Education, we support a $25 million commitment Kaiser Permanente has made to advancing research and education to support the field. And that includes grant making, education, and narrative change initiatives. It's such an honor to be here with such an esteemed panel. Thank you so much for the invitation.
Well, thank you for joining us. And then finally, Dr. Joe Sakran, who's going to yell at me for calling him Dr. Sakran, I have a feeling.
Yeah, I keep telling you, JJ, it's great to be here with such an incredible group of panelists and so many friends. My name is Joe Sakran. I'm a trauma surgeon, just like Dr. Punch, and also serve as Executive Vice Chair of Surgery at Johns Hopkins Hospital. I have the privilege of being the board chair of Brady, as well as the chief medical officer, and have been chairing the This Is Our Lane kind of arm of Brady, which is a movement that mobilizes healthcare professionals to treat gun violence as a public health crisis. And my journey, as some of you know, in this work began not just as a doctor, but as a survivor. At 17, I was shot in the throat, and that experience set me on a path not only to save lives in the operating room, but also to push for systems and policies that prevent violence before it happens. And I think today's conversation isn't just about data or clinical care. It's about people, policy, and purpose. And I'm grateful you're here, and I'm looking forward to a powerful and solutions-focused discussion. Thank you.
All right. And with that,
Jade.
with that, we hand it over to Kris. Get us
Okay.
going.
All right. Well, obviously, after these introductions, I'm sure all of us listening are very, very anxious to hear from this esteemed panel. We don't have to tell you, very, very likely most of you know that the Trump administration has made and proposed in this budget sweeping cuts to federal health agencies, federal health programs, including many that are critical for the treatment, care, and prevention of gun violence across this country. So we really want to dig in, and I have a series of questions to ask each of the panelists. For those of you listening, we also really want to end with a call to action. Each of us, it's very important to get loud, to raise our voices, to understand who we should be talking to about these issues, and really, really stay engaged. That's what we want to have happen. So we're going to try and give you tools for that. I'm going to start here with the question from my friend, Dr. Sakran. Joe, could you give us an overview of the current landscape of sort of contextualizing for folks, if you can, sort of what these funding cuts look like and how they're affecting the development and implementation of treatment and prevention of firearm injuries, either now or what you soon expect? And as you noted, as a survivor, the chair of Brady's board, and a trauma surgeon, how has this personally impacted your work?
Yeah, thanks so much, Kris. God, I'm looking at this panel, and it's such an incredible panel because we all have like these different kind of angles, expertise, niches in this. And I was just thinking about the webinar tonight and just how we're in such a moment of deep crisis. And not just because of the epidemic of gun violence itself, but because of what's happening behind the scenes, the devastating cuts to the very systems designed to prevent it. You know, funding for firearm injury prevention in this country has always been inconsistent and frankly inadequate. But what we're seeing now isn't just neglect, it's frankly active dismantling. The Trump administration has directed agencies to delete thousands of public health web pages and data sets, including foundational tools like Whiskers and the Youth Risk Behavior Surveillance System. They have, of course, eliminated the Office of Gun Violence Prevention, which so many of us fought for. They removed, the Surgeon General advisory declaring gun violence a public health crisis as if it was written in pencil and they can just erase it, right? They've slashed billions of dollars from the CDC, NIH, and DOJ, gutting everything from trauma research to school mental health grants. Even things, like 13 billion in federal grants that were authorized by the Bipartisan Safer Communities Act. And these aren't just, budget cuts. They are deliberate acts that weaken our ability to protect communities. They pause or cancel promising longitudinal studies. They limit clinical training and they strip resources from communities that are already suffering the most. You think about faculty and graduate students also who are losing funding for research roles. I know some folks are going to talk about that. You think about clinicians who are left, without access to best practices, community collaborations that are strained. And I know Fatima, I'm sure, is going to talk about this. Survivors, right, that are facing, long wait times or falling through the cracks entirely. And as someone who has both treated and lived this reality, it's deeply personal. As I said, I survived a gunshot wound. I became a trauma surgeon. I've spent my life building programs to prevent violence before it happens. But we can't do this work if the infrastructure around us is collapsing. And this is more than programs. It's about priorities. When we cut funding for prevention, we're saying that we're okay with the status quo. We're telling children in violent neighborhoods that their safety is negotiable. We're telling survivors that their recovery is optional. And we're telling those of us on the front lines that our work doesn't matter. But I think we all know better than that. And it's on all of us to demand a system, Kris, that reflects the truth and one that treats gun violence as the public health crisis that it is. And of course, invest in that accordingly.
Thanks so much, Joe. These are such critical points. And obviously, from the various actions that have been taken already, the cuts, including to research and programs within CDC that we as a movement have helped fuel after those efforts being completely stalled by Congress for 20 years. I'm eager, Dr. Akbarnia, to turn to you and ask you, you have been on the front lines of really pushing for change and reform around the issue of gun violence prevention. We celebrated getting research dollars for gun violence prevention through CDC. Based on the actions that have already been taken, can you help contextualize for us perhaps the studies or initiatives that you've already identified that have been delayed or even halted, and maybe contextualize some of the impacts for you of that in carrying out your work on the front lines in a trauma center?
Yeah, I mean, you kind of alluded to this a second ago, but we've been through this before, haven't we? Like in 1996, the Dickey Amendment was established to basically halt federal funding for research on gun violence. And that was a huge hit to us. And the amount of money that was actually removed from the funding and the programs that were halted then were staggering. And it did provide us with a place to start for more private type groups to come into play. Like I know Megan Rainey developed a firm, and there are many other groups that kind of came together, but that just wasn't enough. And it just put us back so many years. So that when finally in 2019, we were able to get that funding back again, we were so behind. And so that I think is like a good way to look at how much just remove, and that I think was like something like $2.6 million, which was nothing compared to what the cuts are right now. So thinking about how much we moved backwards from that, looking at the proposed budget for 2025 and what organizations and what funding resources are going to be cut, it's going to affect every aspect of violence prevention research. And not just that, I mean, you're talking about every aspect of injury prevention. So you're talking about drowning, children drowning. You're talking about opioid type research. It's not just gun violence and violence in neighborhoods that's going to be affected. I mean, just you mentioned the Office of the White House Office of Gun Violence Prevention. We saw in the 2 years that they focused on homicide data, how much they improved numbers in cities like Baltimore, here in Chicago, where I am. I mean, we're talking up to 30% reduction in certain numbers. And because they were focusing on homicide numbers, it was very easy to see how those intervention programs and the resources that were put into these organizations really helped. And that's all from research that was done. So some of the proposed budget cuts include like the CDC's National Center for Injury Prevention and Control, which will eliminate programs like the fire injury surveillance through emergency rooms, FASTER program, the research on safe firearm storage. So this is a big area that we were starting to make so much progress. And I know many of the organizations that I'm a part of have been really working on trying to get information into emergency departments, and those numbers will be eliminated. Youth violence prevention research, NIH-funded firearm prevention research that proposes almost $18 billion cut to that budget, which includes studies on firearm suicide prevention, and then again the community-based organizations. I mean, any organization that has used any kind of funding will be affected, and this is just going to be just so tragic to our communities that have spent so much building these programs. So, I mean, we probably can list about 20 other things as well too. And this does affect the frontline workers who take care of patients, because there's also mental health aspects to the research that was being done. There were some studies that I know I have a personal friend of mine who did not want to be named and did not want her study named, but they're working on the mental health aspect of how firearm the research that is being done for physicians and providers taking care of gun violence victims, and how that is affecting. I mean, we can turn to the pit and see that type of information being given from a TV show, and you can see how so many people have taken to something like that. But real information is being gathered by real researchers, and those are just invaluable for people to be able to continue to take care of these victims and not be affected, or learn how to handle the trauma that goes with that.
Just heartbreaking. Thank you for helping contextualize this for our listeners. And, you know, it is really, I can't think of a better word than heartbreaking, because we all work so hard. And when I talk to researchers, we all know that we lost a generation of researchers because of the Dickey Amendment. That was 20 years, basically. And the best and brightest did not study gun violence prevention. We switched that. We changed that in Congress. We got all of the funding. Should have been a lot more, frankly, to catch up. But there are things like one of the research reports I remember reviewing, because we look at this very closely too, is how trauma, including trauma from gun violence, can be passed to fetuses in utero. And so that's the kind of research that's just so important to understand and contextualize this issue that's at risk in all kinds of ways for what we're doing. So thank you, Dr. Akbarnia, for helping contextualize that. And I just wonder if I could turn to Dr. Rajan, who is at Columbia. Obviously, we know that the approach taken by this administration is a stream seemingly every day of different constituencies to attack, and universities are certainly on that list. How are universities adapting and responding to that? And what are your thoughts on how to maintain any momentum in gun violence prevention research in the face of the cuts we see, and in the face of probably political and financial uncertainty in universities that were really essential to growing the gun violence prevention research capability set?
Oh gosh, how long is this webinar? I mean, there's so many things we have, here we're wrestling with. I was just looking at this report by the Association of American Medical Colleges that they had put out on the economic impact, like really just making sense of the numbers here. And it's like 777 NIH grants have been terminated. That's $19 billion in lost funding. 45% of those grants went to medical schools and hospitals. And we know for every dollar of investment of NIH research funding, we generate a $2.50 return on investment. And so I know I'm the word heartbreaking, Kris, I've been using that in every conversation I've had now for the past 4 months, but it's not just the impacts on our inability to ask and study and answer really critical life-saving questions that have to be understood in order to address this public health crisis, but there's literal, practical, day-to-day economic implications we're seeing in red and blue states alike. This is not something that's just unique to here in New York City. This is something we're seeing across the nation. And I think that piece of this feels so especially short-sighted as well. I think so I'm as a researcher who really relies on this kind of federal funding to do our work, as Kris, as you were saying, and others here, we did have this lost generation of research. And what I just think is so remarkable about our research field is that in, end of 2019 or so, we were able to, we saw was not very much relative to the scope of the crisis, but we had some federal investment into this issue, allowing researchers to engage in the scientific study of this crisis. And it's not just it's all types of gun violence impacting people across the life course and across geography. But in that 4 or 5 year period, we saw this enormous rapid growth of new science, new knowledge, creative, out of the box, nonpartisan solutions driven by good data and bringing together like over 24 academic disciplines to really think about how we meaningfully prevent and then also respond to this crisis. And what I just think gives me a lot of hope on days that I don't feel especially hopeful is that we were able to do so much with relatively little in a relatively short amount of time. And I underscore that. I was just meeting with my students earlier today, and I was trying to remind them of that exactly, that we have built an infrastructure and this field is just, I have found it to be especially collaborative and especially productive and generative. The egos aside, it's a very all hands on deck approach. So I just want to say that because I do think that's really important. Now, as we're seeing here, every aspect of our research infrastructure is being attacked, and it's not just gun violence, it's like our scientific infrastructure is being impacted. And I think something that we are really trying to figure out here is, it's not that these NIH or NSF or CDC just give money to universities on a whim, right? This is funding that is earned by teams of scientists, often in collaboration across universities. And these are the funding isn't to, maybe some of it goes to pay faculty salary, but a lot of it is to support our students, our trainees. It literally helps to keep the lights on, in our offices. I mean, think about what it takes to pay for facilities workers and just all the things we need to literally exist and do our work. And so what we're doing right now is saying, all right, how do we take the funding that we do have that hasn't been cut and try to reallocate it? How do we turn to our private foundation partners who have been just with us through thick and thin in all of these moments to try and fill some of those funding gaps? How do we remind folks that some of the issues that we care about, firearm suicide, for example, is also firearm violence, right? And so how do we say, yeah, you're talking about suicide prevention is especially important, and firearm suicide is part of that conversation, especially so, right, in this country. So we're really trying to think a little creatively and out of the box on how we message about this issue. Something that I was in a conversation about earlier today was just how are we as scientists also communicating about how it is we do this work and the importance of transparency right now. I don't know if everyone here would agree with this per se, but I do think establishing some trust in science and in public health again, how do we talk about what we're doing, the importance of it, where that money is going, and how it benefits schools and communities and kids and families. one, all of us can agree we want our kids to grow up in safe spaces, right? They all deserve that. I don't think so. There's so much in our messaging that I actually think we agree on. And I think part of what we're trying to do as academics, this is hard, I think, but we're working on this, is to really kind of retool and how we talk about this issue and then how we advocate for resources. So I don't have a lot of solutions, but we are knee deep in really thinking about that right now and trying to, I think the messaging piece feels especially important in this moment.
Thank you so much for that. And I do think it's really important as part of that to think through the messaging, especially, I mean, what we're talking about are people's lives. So it's impossible to put a price on that. But you said very early that an investment of every dollar provided real dollar returns. And I think really reminding people of that this is payback, not only that we're saving lives, but we're saving dollars in the end with these investments. I think that's a really important point for everyone in the movement to continually remind people of. So thank you so much for that. And thank you for all of your work. I remember when I first met with you, when the first convening of researchers was happening, and it was a smaller group that came. By year 5, year 4, whatever it was hundreds.
Yeah.
And that's just amazing to think of the lives impacted by that and the knowledge and the best and brightest being drawn to this. So I hope somehow we can find a way to continue that.
We will.
Fatima, it's so good to see you as always. Thank you so much for everything you and the Javi do. It's so critically important, and it's just so hard to talk about these issues because on community violence intervention programs across this country, obviously we had the Bipartisan Safer Communities Act with 16 Republicans who voted, and a big part of that was huge and unprecedented and absolutely delayed but important funding for programs across this country that have typically not been funded at the scale that they needed to be funded, grossly underfunded. And this administration, I would say it's death by 1,000 cuts, because even though Congress has already approved and appropriated these funds, and some of the organizations that rely on those funds approved by Congress, rightly so, had budgeted receipt of those funds, the administration announced through DOJ they were rescinding those funds and basically cutting off all of that funding before it's able to fully be realized for the life-saving work. And so with that kind of background, I want to understand from you, as someone in the trenches, what do these cuts mean for community-based organizations like the Javi, particularly in supporting prevention, recovery, and mental health services for survivors?
Kris, thank you so much. And I both feel responsible for naming the immense harm that the rescinding of funds that were indeed supported in a bipartisan way and the enormous impact they have. I feel responsible for both naming those harms and also talking about the enormous resilience in our communities. And so I'll try my best at holding both. So, as I mentioned, the Javi is a national organization that supports hospital-based violence intervention work across the country. We were one of the grantees that were affected. We lost millions of dollars. We understand the Department of Justice rescinded over 360 grantees that kind of not just coming from the Bipartisan Safer Communities Act, but certainly a larger portion of grants that were really to support services for those who are at very high risk, who from domestic violence to firearm injury, many needs. You mentioned mental health, that programs that support children and adults. It's quite sweeping, the cuts totaling nearly $1 billion. And within that, the smaller portion of funding that supports community violence intervention, largely affecting really small community organizations that were in community doing enormous work on a very lean budget. These are nonprofits whose total budgets are less than $1 million, really small budgets that were for the first time entrusting, have a partnership with the federal government to expand and deepen their work in communities. Community violence intervention largely looks at the needs of those who are at elevated risk of violence, largely in communities of color, where violence has been raging for decades. As you know, a few years ago in 2021, we heard the CDC's announcement about violence being the leading cause of death for children in the United States, all children and adolescents. But we know from the research that African American children and young adults are 19 times more likely to be injured, 10 times more likely to die from firearms. So there is a disproportionality and impact and a real opportunity to lean in and support and transform the lives of those who are at elevated risk. And that's what these programs do. They work trying to identify those who are at very high risk and have incredible promise, and work to support through addressing the social determinants of health, people who need housing and supports around economic. So when we think about what the impacts are, they are enormous for transformation locally. And the people who are transforming their own communities are enormous heroes. They're peacekeepers. These are individuals with lived experience who hail from the community. And our model partner closely with hospitals to deploy a model that really serves community in these enormous ways. And so when we talk about these cuts, and specifically, yes, within the Department of Justice, over 360, but we're looking at the smaller subset of roughly 65 grantees, roughly $150 million in awards that were cut. These awards, the amount of it's catalytic, I think, the impact these funds could have had in communities in specific zip codes that really desperately need these resources. And alongside that heartbreaking, we use that theme, the heartbreaking impact, I want to speak to the resilience. When I speak to communities, and we have organized and have held press conferences across the country last week in 14 cities talking about the enormous impact of community violence intervention, what people speak to is that they will continue to partner and do the work because the work must be done. And we are thinking as national organizations how we might support communities and marshal the private sector, the healthcare, as many sectors as possible, to recognize that we owe survivors, we owe those who have lost their lives, who have family members who live on, we owe them to ask the question, what can we do now? Even given this enormously difficult task of figuring out what we do in this context, we owe them the question and to respond. And I think that is the call to action here, is to think about unlikely allies in this fight, opportunities to call the question and enlist a whole new generation of people and who can engage and believe that there are solutions, and we're going to continue those solutions. So I am a recovering optimistic. I think that in any time there's an opportunity, and I think this is one for us. We're going to ask hard questions. We're going to have to get even leaner. I can't say there is an enormous impact. Of course there is, but I really believe we're dangerous because there are a number of people across the political spectrum who believe that violence is a health issue, who believe that there are solutions that we can touch today. And our polling demonstrates that. So I heard Dr. Rajan talk about the messaging, and I know Brady has done messaging too. The messaging is clear. There's many more people for and with us than not. And it's our task to tap and engage them. And I think it takes storytelling. I think it takes reframing. It takes a much, much more work. But we're up to the task, and we're going to partner and do that together. So, I think it's going to take quite a bit, but we're here. We're ready.
Well, that was very inspiring. I don't think your title of recovering optimist is a fair characterization, because you have stirred my cynical heart, and I appreciate that dose of call to action. We all need to hear that. I really appreciate that. And Dr. Punch, Fatima talked about this a little bit in her answer. But you, in your dual roles in the hospital, within hospital and community settings, how do you maintain effective care and advocacy in communities most impacted by gun violence and most at risk because of many of these cuts that are happening?
Well, thank you, and I appreciate what everyone has shared already. So I currently do practice in a setting that is in a community-based clinic. It is a clinic that cares for people in a holistic way and also engages the community richly. And I will say that we have experienced the current climate not unlike we experienced 2020, and we're calling it a political pandemic instead of a viral pandemic. And it's helping us understand the stresses, because guess what? In the midst of the COVID pandemic, where our operations and activities were threatened, we found a very deep why and a very powerful way forward. And that's what we're finding now, being totally conscious and aware of just how much suffering is surrounding us, but also committing to the deep why of why we do the work, which is that people are worthy, they're worthy of care, they should have their pain and their wounds addressed, and that when we decide that that's important as a community, guess what? Less people get hurt. It's really simple and fascinating and wonderful. So on the front line of community-based care, we have prepared ourselves for the shifting political winds of this pandemic and have prepared ourselves by, again, as Fatima already mentioned, getting lean. Real talk. This is not the time for that. This is the time to dig deep and insist on sustaining and continuing the work. So that means, hey, we don't come to everyone's barbecue anymore. We don't do every single event. We don't come to every opportunity there is to talk and share. We focus on the work and we dig deep. And we tell our patients and our families the truth about what's going on, and we invite them to become even more parts of their healing journey. One of the pivots that we did last year was to recognize that the work of the Bullet-Related Injury Clinic is not just about the work that we do. In fact, we can only do a tiny, tiny, tiny piece of the work that needs to be done. It's really about bringing awareness of bullet-related injury and its wide sweeping effects and impacts, and helping others have capacity to heal. And so that means both in the St. Louis community, making sure as many people have these tools in their hands as possible, making this widely accessible. We've decided to democratize the knowledge and resources of the BRIC through our virtual resources that are available on our website. And we've even started sharing this with other organizations throughout the country so that they can get care into the hands of people. Here's the bottom line. 50 to 70% of people who are shot will be seen in an emergency department and sent home. There is no dedicated aftercare medical clinic that is holistic to care for the numerous needs that come when someone has been shot. And we know from the data we do have that one of the most significant risk factors for a fatal bullet injury is a previous non-fatal bullet injury. And one of the most significant areas where this is not seen is when it's not a physical wound, but when it's the loss of a loved one or a threat or even witnessing. So it's been very important for us to dig deep into our why, understand what's happening and why, understand our commitment to serving our community and to be steadfast in that, to be honest, transparent with everyone around us about what it means, and to insist. Listen, we decide first what we're going to do, And then our resources determine the scale at which we can do it. And we're going to do it no matter what. We started as a volunteer organization and we don't care. We're going to do this. I do think it is sad because we have also been one of those organizations that was defunded, that there were so many organizations that were encouraged to pursue federal funding to prove they were big enough to sustain. That was the message we got from our local funding community. And then that same funding that we were planning on for not just 2025, but 26 and 27 is now gone. And I think that that is something that, whether it's philanthropic movements or other kinds of basically spaces and places, healthcare systems themselves who can fill some of that gap, really need to be conscious of, because it's those smaller places, smaller than us even, that really put their heart and soul into getting that federal opportunity, only to have it removed. So again, I appreciate the chance to share. We are endlessly optimistic. We have to be. We are an act of resistance in a community base. We practice Black Panther medicine at the Brick, and we're not going to stop. Nothing's going to stop us. We also want to call to accountability to everyone who's aware of what's happening, because it really is serious and it can have lasting impacts, not just in St. Louis, but through the country.
Dr. Punch, you pack quite a punch. I love listening to you. So many takeaways, political pandemic. I mean, huge, important messaging, and you got a lot of shout outs on the chat. People are worthy. Yes, people are worthy. And we need to keep repeating that over and over and over again. That's the fundamental point that we're acting from. I know so many people here who are listening in are very eager to hear some of your thoughts. So I'm going to throw this out to the panel in no particular order. Whoever wants to start first, and happy to hear from everyone around this. But based on the conversation that we've had so far, and then we're going to get to some of the questions in the chat, I promise. And JJ noted we're going to go a little over because of probably me and the technical challenges I had. So apologies. But how can two constituencies, if we think about it this way, really help to try to raise the profile of the host of issues that we've discussed here? Because I do think messaging and communication around this is super, super critical to keep this and the impacts in the public eye. How can, from your perspective, other healthcare professionals most effectively engage around this, policymakers, or even the public, you know, in their communities, their role? And what about those outside of direct healthcare work? What are your thoughts around that? And so I just want to throw it out to you all to think about it. If you don't have an answer yet, I can come back to it. But if anyone has thoughts around that, we'd love to hear them.
I can start a little there. We were in DC a couple weeks ago with our EM group doing advocacy around different key topics, workplace violence, which is affected by all of this, Medicaid cuts, obviously. And we noticed that it happened to be the day that Jeffries and Booker were sitting on the Capitol steps, and they were listening to stories of people just coming up to them and talking to them, and they were highlighting these stories for 12 hours, basically. And I think, as Sonali had put it earlier, like our role in this is to continue to highlight the stories of our patients and to highlight that things that they can't always do for themselves because either they just can't. And there are HIPAA guidelines to some things, but we can tell people what we see and how people are affected and really take it to a level that people might understand. And I just noticed that the stories tended to be the things that people really listened to. And from then on, it's been almost every day that a different group goes out there, sits down, puts on stories that they put online, and the lawmakers are listening. And I think that as long as we continue to push it from an advocacy level, I'm part of a group, Doctors for America, and that's a lot of what we've been doing. I mean, we even sued the government for the pages that they removed initially and won that. Not that that really made a big difference, but I think continuously being involved in groups like Brady, Doctors for America, the advocacy groups that are putting out stories and messaging, I think that's a great place for us to be at, even if we've never been in that space before. And finding new voices out there, I think has been really refreshing to hear because there are people popping up telling these stories from a healthcare perspective.
Yeah, the storytelling and the various constituencies and the lived experience. I completely agree with that. And thank you for all of your leadership in that area.
I want to add and maybe expand what Dr. Halleh is saying to include opportunities we might identify to engage unlikely allies. I think that is enormously difficult. And I want to say this as one who I really celebrate the deepening we do in community when we share similar language, we share even the values that undergird our messages. There's something in it just there's something that feels so good about being in our own echo chamber. But I think that the opportunity we have is to engage a whole new set of people who may not speak the same language. They may not go to the same blogs or follow the same people online, but are the kind of unspoken, unaccounted for middle that I think we do need to engage and bring to our movement. And what I love about the health sector is that there's enormous diversity. And I think there are opportunities there for us to engage in meaningful ways. I think people, we say quite a bit, violence is a health issue, but I realize not many people really understand what we mean when we talk about public health as this process and this mechanism and this framework. And yet, I do think people understand, and I'm so appreciative of the physicians on this call who treat people who've experienced violence, because I think those stories are really compelling. But I think it's about the setting in which we tell them. I think it's about a call to action is let's go to the podcasts that have a different followership and work on, and I think it takes some time to do this, right? To actually work on where the bridge is. I certainly have been working on, for example, conversations with law enforcement. Some of my early work, my clinical backgrounds in behavioral health, was actually thinking about for veterans and law enforcement who have higher than usual mental health challenges and suicide rates, to engage in conversations about violence that bring them in as a bridge to then talking about, well, how do we think about health approaches in new ways and not just law enforcement focused approaches? Enormously difficult conversations, but ones that have actually helped move the needle. And those people that I engaged years and years ago, friends, who are now police executives across the country who celebrate and advocate for health-focused solutions. So the power of those kinds of conversations can have catalytic effects for years to come. I think it's about imploring all of us, charging us with that work. Sometimes it's within our own families. I know that we've got many people who have families who are across the political spectrum and then have just chosen to stay silent. These are the opportunities to lean in. Who in our family can we talk to? I think that work is important. It takes all of us doing that important work. I want to lift up some incredible work happening at the Ad Council to support all of us in engaging those conversations. The Agree to Agree campaign. I've just been so moved by the ways that, again, pulling from the research and I think the reach of the Ad Council. In comms campaigns, when they said, our audience can't be the general public. Well, I think the Ad Council can actually say that their audience is the general public. They just really brilliant people who've really tried to offer conversation starters. Where can we start? And I think that level of pragmatism is going to be essential. So I wanted to put that out and name that and name that many of us have been supportive of those campaigns and just believe that we're going to have to do all of that in order to move the needle.
Thank you so much.
Kris, can I for a second just build off of, because I was going to talk about the unlikely ally piece. I know build off what Fatima said, because I think her points are spot on. I think there's a couple practical things that we have to consider if we want to expand this tent when we think about kind of bridging that gap. And I think it starts with shared values, not policy points. Most people, regardless of political party, they believe kids should be safe at school. They believe that families should be safe in their community and that gun ownership should come with responsibility. Focusing on that shared humanity, I think, allows us to lead with, the safety that's so important, not slogans. The other piece is that we have to do a better job of meeting people where they are. And that might mean at churches, in different communities and circles, and to frankly listen more than we talk, understand, their language and understand their concerns and figure out where those goals align. That's something we haven't typically done a great job of always because, as Fatima points out, it's very easy and comfortable to be in our own kind of echo chamber. And so I think if we're going to expand this tent, especially at a time when things are so polarized, we have to do all of that. And I think it's just so critical now more than ever.
Just to add to that 1 second too, the goat meeting people where they are is so key. We are seeing that with how we're messaging measles in general. Like even people who are hit by it in communities that have 2 kids in their family that have measles, they're still not necessarily vaccinating the other 2 because we're not talking to them in the language that they understand. And I think we learned so much of that during COVID, and we just have to remember those lessons, the trusted messengers, the reaching out to like those unlikely advocates that you don't think are so I totally agree with that. Listening more to those communities is essential.
It is. I was going to add, sorry, now we're just like adding on. So I just like spurring like a thought, but I feel like when we piece this together, we have like a comm strategy here that we've like figured out.
Yeah.
But something I'm just going to add, again, with more of the prevention sort of hat on, but something I love actually about our collective research field is that there are constantly over the last few years have been just the generation of new research findings that are very surprising and not necessarily things that you would associate with meaningful gun violence prevention. Like, so I'll just give some examples, but like cleaning and greening vacant lots, or ensuring that folks have affordable housing, or street lighting, or ensuring that teens have access to jobs programs, or support for early childcare, or investing in public libraries. Like, if we were each to ask a person or an elected official, what do you think of when you think of gun violence prevention? Probably none of those things that I just said would be top of mind at all, right? The conversation has historically and very myopically been on sort of a smaller set of solutions. And I'm not saying that, certain policies or practices are not important. They are, but they're clearly not sufficient. And if we actually think about gun violence as a true public health issue, it actually involves breaking cycles of disenfranchisement, investing in schools and communities in ways that actually contribute to better lives. And then the benefits from that go far beyond reducing gun violence, which is the part that I actually think is most powerful. Like, you see all these other benefits of pro-social cohesion and like just all these things we get from doing the things I just mentioned as just a few examples. And I do wonder also that part of our, maybe something that feels like a bridge between Kris, to go back to your original question, but sort of like a bridge here in how we talk about this is talking about the science that we know works that has nothing to do with encroaching on the rights of firearm owners or anything like that, and has everything to do with wanting safer, healthier communities for everybody, which it's very hard to disagree with that as like a premise because everyone is deserving of that, right? Just to go back to what Dr. Punch said earlier, I literally wrote, by the way, what you said here, right? That people are worthy and worthy of care. I just think that premise is so core to this. So anyway, I just wanted to add that as a thought because I do feel like that's like another opportunity to expand the conversation.
Thank you so much. Dr. Punch, do you have anything to add to the insights and comments thus far?
No, I think everyone's saying it. And the only thing I would offer is my practice is inside an area where bullet injuries are endemic. And the sort of between the larger state and the local reality, owning a firearm or being in proximity to a firearm is a given. And so much of our framework shifting from either the gun or the violence and toward the injury, and welcoming people, not requiring them to identify with any particular act of violence, victimhood, firearm ownership, or any of it. Just saying, recognize the air around you is not safe. And you've been impacted and you matter. And that's all I'm here for. As a physician, has been a very powerful starting point. And so that's the language in the clinical world, I think, is an opportunity to move beyond gun positive and gun negative frameworks and into what I know for sure, which is that bullets injure people. And that's one of the ways that we've been able to move forward and have conversations across the spectrum of gun attitudes. And also invited a whole new kind of care, which moves beyond the bullet and really into people's lives and all the things that Dr. Rajan was just talking about.
Thank you so much for that. I guess just to touch upon sort of the impact and get thoughts from those of you who are close to this. I mean, as we had talked about with respect to the research funding that was restored at CDC, what we saw is with the injection of federal funds, which probably for everyone who's participating in this webinar, you understand the basic premise that all research of any kind that is of a national scope and interest is supposed to start with the federal investment, and then the private sector participates, right? That's the way that it's worked from time immemorial, which is why it was such a plague that the CDC funding for gun violence prevention research was cut away under the Dickey Amendment for so long. That spawned a generation of new researchers to the gun violence prevention issue with all kinds of really, really interesting research along the lines that you described, Dr. Rajan. I mean, in all of these, probably not totally surprising, but unexpected areas for a lot of people. It's very important. With the funding cuts, the uncertainty, the focus of this budget, which is really paying no attention, really trying to be as hostile as possible. And effectively, let's just say it, pretend that gun violence isn't the #1 killer of our kids. Pretend that gun violence isn't endemic in communities across this country. Just pretend it doesn't exist and be hostile to everything that has happened. How is that impacting folks who may be younger, who are thinking about coming into this space? What is the impact so far, if you could comment on that and help us understand how you're talking to folks? I'll start with you, Dr. Rajan.
I mean, it's devastating. I think, don't entirely quote me on this, but I think of the NIH grants cut, something like 60% were career development or training grants, which are foundational, right, to our graduate students, our postdocs, our early career faculty. Like, literally imagine trying to build a career in any other field, cancer research, or I mean, literally any other topic, and not having the funding to do the work you need to do. For the longest time, I mean, I've been a faculty now for 12 years, but at the first half of my career, I had no funding. I wasn't a gun violence researcher. I was a school health researcher, and I still consider myself in some ways in that space, but I had no funding to do the first few papers and work I did in the space. There was no funding for it. I did in my free time. I did it because I was interested in it, and I had colleagues who were supportive of those ideas. So this idea of actually, like, what we've done as a collective field over the past 3 to 4 years has been to rapidly build out a training infrastructure so we can train our folks across disciplines. I'm talking like 24 disciplines so in every way you could, nursing and epi and education and anthropology and law and medicine, but training them to do this work, which requires care and thought and compassion, and also methods and tools that don't necessarily get employed in other areas. And when we take away these T32 grants and basically all these training grants that allow our doctoral students or our postdoctoral fellows or our medical residents to study and train this as an issue, it means that they can't do this and they end up going into other areas, which is that's fine. That's a very practical response, but it means we are now yet again at risk of losing another generation of researchers. Well, we just have managed to build and make some progress in this. And as someone who has many doctoral students, I'm about to hood 3 of them next week. I mean, it is devastating, right, to see that loss of funding. And I'm so grateful to our private funders who are doing the best they can to step in and support and think through this with us. But I can't underscore enough how devastating this is to the pipeline of researchers that we need to take on this crisis, which, Kris, as you have underscored, is the leading cause of death of children and teens in the US, which is that's absolutely unthinkable. But here we are, and we have a responsibility to address it. So I got no good news on that one. That's just bad news overall. But again, like I said, we're trying to do our best to reallocate resources and to help support our students and trainees to pivot as best they can in this moment. But it's tough.
Yeah.
Dr. Rajan, I think that that's such a great summary, and it's so spot on. And that pipeline that you talk about, frankly, that pipeline is breaking. I mean, we have all seen, I think, brilliant medical students, residents, public health trainees that are passionate about this issue that either suddenly face canceled grants, paused fellowships, loss of mentorship because advisors are losing their funding. And I think that's not just a missed opportunity, but it's a systemic failure. And we're really, in many ways, I think, choking off the next generation of clinician advocates and researchers and even policy leaders at a time when we need them the most, which, back to, I can't remember who said this, maybe it was Fatima talking about resilience, right? We need, the mentors, people like the folks on this call to really kind of dig in and dig in deep and, not lose that hope, understanding that, yes, like times are tough, but we have to be able to kind of, I think, show a path for that next generation of healthcare leaders and researchers. And, the reality is like philanthropy has stepped up in some different ways, but let's just be honest about where we are, which is philanthropy cannot fill the gap that we are facing. That is a fact. And so, we got to, I think, think about this in very innovative, creative ways, but also ensure that we're kind of that rock for those that are coming through that pipeline, which is being just destroyed right now.
Yeah.
I'd like to pick that point up about how we might innovate and recognize that private philanthropy, can't do the work. We are seeing, of course, in philanthropy, as you imagine, with large endowments increasing their commitments, annual spend in order to meet some part of the moment. But I do think that we've not thought creatively. I think there are opportunities to think creatively about financing models. And I just returned from the Milken Institute. Milken, of course, is a gathering that is quite unique in its reach and broad network within the financial sector. And I was deeply moved by the leadership declaring their investment in identifying innovative ways to support gun violence. They have seen, given the number of mass shootings, school shootings across the United States, that it's become a business problem. Right, it's in fact impacting the business sector because, as I heard at the conference, people in other countries, people who are not in the United States, who live in countries that are much safer, are concerned about investments in the United States. So it becomes a business problem. And I think that with that understanding that there's a real loss in economic investment comes, I think, a new sector of potential partners who might help us articulate opportunities for the future. And I think it's going to take some time to do that bridging, but it exists. It's possible. I think about the private sector and R&D, right, research and development to spur innovation. And while I think thinking about kind of the risk portion of that, if gun violence is considered a risk, there may be new investments in research to prevent gun violence. Like I think that those are line items within multinational companies. Perhaps we can think about ways of tapping those sorts of budgets to engage new trainees. As an example, I'm really speaking truly with the kind of let's throw spaghetti on the wall and see what this is kind of the brainstorming, but we need the brain trust, and that's what I hear. We cannot afford to lose another generation of trainees. We can't afford to lose a generation of peacekeepers who are in community. I think there is enormous opportunity, but we're going to have to get incredibly creative. I probably be remiss to name that. I think there are other playbooks that look at the role of litigation and its ability to spur and expand the finances, the winnings from those sorts of litigation strategies. I think people are beginning to think about that in various industries. I can't speak to that directly, but I understand it as a strategy that can be deployed in this time. So I'm encouraged that there are smart people who are thinking about this, and I want to enlist all of us to continue to push the envelope, ask hard questions of one another, and see where the opportunities are.
Thank you so much for that. I feel like we could spend hours together and still learn so much and still, while this is a very hard topic, inspire others to action. We heard from Lori Van Orden in the chat, find the helpers. That is all of you. Thank you for your work. You lift my heart in these challenging times. And I think for those of you who are incredible leaders, giving so much of your talent and your time to save others, we all owe you a huge debt of gratitude. So thank you for being those helpers, for fighting the good fight. Every life is worthy. And the work is so very important. I think we've heard a lot of incredible ideas about what we need to be doing collectively here. And I'll just close out by saying, obviously, with Dr. Sakran, we have This Is Our Lane as an intended resource to those who are involved in the healthcare profession or healthcare adjacent, which is all of us in some way. And so to find out more information about how you can get involved, go to thisisourlane.org. Of course, you can also visit bradyunited.org. You've heard from these incredible speakers today, and I'm sure they'd be happy if you were to reach out and find out more about the organizations that they are helping to lead. What we heard is the importance of communication, of bringing non-traditional constituencies together, of storytelling. Joe said, start with values, not policy points. I mean, we talked a lot about communication here, and that is also up to each of us. We think about it as, what is your sphere of influence and sphere of control? With gun violence in America, that's in your home, in your family, in your community, in your state, and at the national level. And there are things to do in every single one of those places. And so we need you to get loud, share the impact that these cuts are having on real people, help lift these examples up, and tell the story, put a face on this issue, and stay engaged. It's super easy to get overwhelmed and burnt out. That's what they want. That's what they want. But we can't let that happen, and we can't stop paying attention. There's too much at stake. So thank you all for participating. Really appreciate it. Stay in touch with us through This Is Our Lane. Join our email list. and reach out. And thank you to our incredible panelists for your time and everything that you're doing. We appreciate you so much.